folks could begin to find your seats. We're still waiting for a couple commissioners, but we'll get started without them if you need to be. It's now 1 o'clock. The budget work session for the Seminole County Board of County Commission. We appreciate everybody's patience today as we get through this as efficiently as we can. I appreciate you all being here. Our next up is going to be the 18th Judicial Circuit Court, the Honorable Chief Judge Melanie Chase. Ms. Chase, welcome.
Thank you. Thanks for having us. May I have the floor for a moment? I want to be...
I'm never going to argue with a judge. You can have the floor as long as you'd like.
I cannot...
doubt that. Mr. Chairman, point of order. I believe that you've argued with many judges in your time, just not here in this county, maybe.
I want to thank you all. I know that you normally reconvene at 1:30, and I have asked you to accommodate me, and I'm very grateful, but I want to tell you that I'm in the middle of a jury trial, so you are accommodating not only me, but you are accommodating a jury full of people. You've got the sheriff's office and the clerk's office, so we're very grateful for that.
And that means you'll be very efficient with us today.
Will be a few words, I assure you.
Thank you. Go ahead.
The judicial budget totals $1.4 million. You can see on the slide above what the breakdown of the funding is that supports the budget, 33% from the general fund, 39% from the Article 5 fund, and then an additional approximately 28% from grant funds and agency funds. This slide shows their general fund impact. This is the general fund and the Article 5 fund, totaling $1 million. It's a 5.7% increase, and the entirety of this increase is related to existing personnel costs. They're requesting no new FTEs, and they do have one highlighted item, $44,000 for the first year of a 3-year laptop replacement program that the judge is going to talk about.
So we got a letter in January from Darren Gray that said flat budget, message received, flat budget. I wanted to tell you just a couple of things that we're doing to try to save you money. First, I hope when you talk to your management folks, I hope that they tell you that judicial is, we try to be good stewards of the money. We ask for, not just on budget things, but we try to not cost you money on the little things, especially the civil courthouse, since you are making this expenditure for us to combine the courthouses. We're very grateful for that, and we try to not cost you money on things like facilities for the older courthouse if we don't have to. So I hope that you're hearing that back. In addition to that, we have, this is Brandy Jenkins. She is our budget, brilliant, wonderful employee that handles all of it, and she's good at looking for ways to move something from a county item to a state item, and she's been able to find some software and some equipment things that also fit with the state, so she's been able to work on that. And so we've made some headway with that. The one thing that we are asking that you consider, if you would consider, we are asking for $44,000 for laptop improvements. The judges we don't have paper folders anymore like we used to. You know, you used to go get the file from the clerk's office and go to the courtroom. We don't have it anymore. We're all on laptops, which is great. It makes us more efficient. I hope that, you know, we can sign warrants, you know, whenever they need to be signed, and we're more accessible. It also makes us kind of live or die by the laptops. So Ivan Yanis, the trial court administrator, explained to me that software gets out of date and licenses get out of date, which I was not as aware of, but so that is becoming an issue. So the $44,000 that we're asking you to consider would help us with 1/3 of the computers. So we're not coming to you and asking for everybody to get a brand new shiny, but it would just update things. So we thought that it was a reasonable ask, but that is the only item that we're asking you to consider granting us.
Great.
So.
And one final slide. The judicial has $400,000 of non-general funded budgets. These are budgets in agency funds. They were not included in the FY25 adopted, so the slide shows them as increases, but these are not true increases. They have a total of $400,000 for adult drug court and the court program drug lab. And that concludes our presentation.
Okay. Any questions for the judiciary?
Mr. Chairman, the only suggestion that I would have would be to the county manager. I think the request that the judge is making is very direct and very straightforward, and I'd like to see if there's a way to include it, and if you can report back to us later, I'd greatly appreciate it.
Okay. Commissioner Lockhart, and we'll come on right on down the line.
My apologies for not being here when you first started. Where are we with the courtroom requests that were made in the in the reorganization of the new criminal courthouse? We had originally talked about budgeting for one additional courtroom. Are we still looking at that, or have there been changes to that request? So I haven't been able to talk to Mr. Gray.
Yeah, I can, unless you want to answer it.
I can tell you that this administration is looking to reduce what we had asked for before, because I think we can, without it hurting the citizens in any way, and the judges will still be okay.
Okay.
I've talked to your administration about how much money we can save if we can even reduce by even a courtroom. So, but we're still early in the
Right.
process, right?
Okay.
But we're
And
open.
So we have been meeting with Judge Chase, gosh, for probably about 3 to 4 months now, and her staff to get them up to speed on the renovations over there. Chad Wilski is communicating with Judge Chase probably weekly or every other week.
He's great.
Week about
He's great.
not only that, but other courtroom improvements to the existing stuff. We are getting ready to hold a, one, to update you all where we are on that, and then hold a user group meeting to update everyone on where we are in the process. We just finished the negotiation of the CMAR, so you're going to see that coming, the GMP coming up pretty soon.
Okay, great.
Thank you so much. Thank you for your work.
Thanks for accommodating me at 1 o'clock. I wanted you to hear that because I have a jury, and so I appreciate it. I didn't want you to miss that.
Thank you for working.
Oh, my. Commissioner Constantine.
Nothing. It's good to see you, Judge.
It's good to see you.
I have nothing other than just a question. Is the FTE that we afforded you last year, is that working out well?
Yes, I got
Helping
some.
you?
So well. I won't bore you with statistics,
Sure.
but I brought them in. It's going really, really well.
Good.
Hearing a bunch of cases, very little pushback. I had thought we might get a little bit just because it was a new system. It's great. I mean, it's really some of the best money that you all give us. Really.
Good.
So we're grateful.
Well, I would tell you from my experience, I wish the state would do some additional funding. I think a lot of us do. But it's imperative in the judicial system, not only for the judges, but the attorneys, the jurors, to make things as efficient as possible, and they're not always that way. And trying to bring all those things together and get people in and out and get your dockets cleared as quick as possible sometimes can be a struggle. So I hope, and I will continue to advocate at Tallahassee for additional state funding on so many fronts, not only for the judiciary, but I think the clerk's got some issues. There's state's attorney's got some issues that should be funded through the state as well. So thank you for doing the best you can with what you have. We sincerely appreciate it very much.
Thank you.
Commissioner Herr?
First of all, I do every now and then get calls from some renters over there in our old courthouse, and I just ignore them, so you know. And I get to do that. I would say yes on the $44,000 for the computer. Certainly, you're now beholden to them in a way that you never were before. I would also say that at some point, does not need to happen now, but figure out what the life cycle is and get it into the budget every year so that you're never in a position where you're bagging. That would be the goal. And that includes the software and the hardware, because it is what it is. And we've learned the hard way that that's the process for doing that really, really well. And we do appreciate all of you and everything you do. That's it.
Anything further? Seeing none? Thank you, Your Honor. We
It was
sincerely
so
appreciate
good
it.
to see all of you. Thanks
as
so
well.
much. Thank you.
Enjoy your
All right.
day.
I'm headed back to trial.
Well, good luck. All right. Next up is going to be the Clerk of the Circuit Court and Comptroller, Mr. Grant Malloy.
Good afternoon, Commissioners. Pleasure to be here. I'm with my Comptroller Director, Jenny Spencer, who works very closely with all of you and the county staff. So we have a very short presentation. There's really nothing majorly changing in it. I've talked to all of you. I'm sorry I missed the meeting with you, Commissioner Herr. I had an issue I had to attend to, but didn't really hear a lot of objections. We can go through it fairly quickly. It's basically the same thing we're doing last year. We are looking forward to reduce 1 FTE, and it's basically the same services, and I'll let Jenny Spencer go into the detail of the presentation.
Thank you. And Ms. Spencer, if you could pull that microphone as close as you can. I know you speak very softly.
Okay. Good afternoon,
And she carries a
Commissioners.
big stick.
Good afternoon, Commissioners. We had an opportunity to meet with each of you to go over our requests. Overall, before I go into the overall increase, let me just explain. Our current year budget that was approved was $5.7 million. If you compare that to the proposed budget of $6,137,861, it's approximately $352,000 increase, or 6.1%. You may recall in October, we presented a budget amendment for $86,000, which brought our overall budget for a net increase of 4.5% from our request for fiscal year '26. And that is broken down by 4.5% is personnel and related benefits, 1.5% is operating, and $34,000 related to capital expenditures. Like most organizations, approximately 74% of that budget request is related to personnel costs, and the others are operating. One of the items that we highlighted during our briefing is the lease at the Record Center, which will expire in May 2027, and that's approximately $390,000 for that facility. And this budget comparison just really shows the current fiscal year '25 with the proposed fiscal year by department. And as I mentioned earlier, the $6,137,861 in comparison with the adopted budget of $5,786,163 is a net increase of $352,000 approximately, or 6.1%. When you factor in the budget amendment that was approved in October, it brings our current fiscal year '25, approved an amended budget of $5,872,000. That, compared to the request, is approximately $266,000 more, or 4.5%. The next slide just really shows our proposed FTE, which is approximately 37.39. Now, you may wonder why 0.39, because there's some FTEs that are allocated, and compared to the current fiscal year of 38.25, showing a net reduction of approximately 0.86. And this concludes our presentation.
Thank you very much. We like efficient presentations. I will start at the far end with Commissioner Lockhart, and we'll come back across for any questions or comments. Please.
I'll just ask you the same questions that I asked our prior two constitutional officers, and I'm asking this of everyone. Looking for your lapsed salary dollars for the last several years, average, would be great. And then your budget to actuals at the line item for this year and for the prior 2 years, and that's for all funds.
So, that's fine, we can provide you the information. Commissioner, you may recall you requested our budget to actual.
I did.
And we provided that, and it shows, actually, for fiscal year '24, which is the most recently audited fiscal year, there was a dollar variance of $51,823. In comparison with what the board transferred, there was a shortage of $51,823 that was funded by fees, which means there were no lapsed dollars.
Okay, so I'm asking for lapsed salary dollars. So lapsed salary dollars is one question, one bucket. And then the other question is line item budget to actual for all funds for 2 prior years and this fiscal year. And so if you provided that to me, I have not seen that. I apologize.
What I provided, which I thought your request was, you wanted to see what the board funded by department, and that's what we provided. We showed which staff could, the budget amount that was approved, that's something staff could trace to the general ledger, and we provided how it was spent. But what we can provide you with detail by line item as you requested. We have what we call a county fund, which is how the dollars that are transferred to the clerk, we can provide the detail that will match what we provided the schedules before for each of the funds. You said you wanted, we have 3 funds. We have and the general fund is comprised of the court fund, fee fund, and the county fund. And then we have also the 2 trust funds, which are special revenue funds.
Right.
So I asked the same question the same way of everyone, and I'm not sure if I need clarification, and if my question is unclear.
If I can ask the commissioner, I think what the commissioner is asking for, I think what I heard was you supplied department-level information. I think what the commissioner is asking for is line item detail, which would be under the department and every line item under that department.
For the entire
I think.
organization.
For the entire organization.
I think
Yes,
that's
ma'am.
what, is that correct?
Yes.
Okay.
I apologize. I was interpreting that to be the county fund that you were requesting. So we're
No,
providing
and
for the
you
organization.
asked me for that clarification when we were in my office, and I said all of your funds.
Okay.
Now, bear in mind, on the Clerk of Court Operations Corporation, that's all state-controlled, and...
I would like all of the funds. Thank
We
you.
can provide that.
Appreciate that.
Commissioner Constantine, anything?
Nothing.
Commissioner Delory?
No, sir.
I have nothing. Commissioner Herr?
I do know during briefing, Jenny did walk me through the fact that there were a lot of things that were moved into information services, which is generating the 29% increase, but I did not capture what that was, and where were they moved from?
I also provided, it was actually addressed to Commissioner Constantine, the detail of what makes up the expenditures related to IT. A lot of the information subscription contracts for the Comptroller's Office were moved into the IT budget. So we provided a detail of communication costs, professional services, and repairs and maintenance. And we provided the breakdown of which department they were related to. So if they were information services and some were Comptroller's Office. And we indicated whether or not they were recurring or one-time expenditures.
And the reason for that shift was the new GASB standards on accounting makes this a more accurate picture of where the cost should be charged to. I will point out, too, that we love working with the staff. I've mentioned all of you. We keep shrinking our footprint, dedicating more space over in the record center to the sheriff's office. And when you take a look at the reduction because of going paperless, we've reduced our footprint throughout the county of about 19,000 square foot. So we keep trying to look at efficiencies. We have the most efficient comptroller office compared to similar-sized counties. So we're very proud of that and continue to work towards that goal of efficiency.
Anyone else?
So Commissioner, I just want to make sure I want to address a question. You wanted to understand which contracts were moved under the IT budget? Was that your question?
I guess I'm trying to understand the entire fiscal impact. So if you moved them from the departments into there, does it move it from one fund to another fund?
It's all in the general fund, for the clerk's general fund, and under the county fund. So they would just move from one department. We have a department called Comptroller, and we have one called Information Services, so they would move from the Comptroller's budget to Information Services. And as the clerk mentioned, is really to help when we're assessing which IT subscription should be evaluated for GASB 96. It allows us to go to one department and assess all the contracts in that department.
That note I had in my notes, just so you know, Jenny, I was listening. I got that part of it. But then the question came of, well, I think it's easy from an administrative perspective, but you wouldn't be out of compliance leaving it the way it was.
It's
not a compliance
Actually, we've
question.
done something similarly on the county side. We've created an object account specifically for IT subscriptions to enable us to just pull that account, similar to how we do with rental and leases when we're assessing which leases that may be impacted by GASB 87. We go to that object account and evaluate each of the transactions in those accounts.
Okay, thank you.
Thank you. Anything else? All right. Thank you all very much for being here. We sincerely appreciate it.
Thank you, Chairman.
Commissioner Lockhart will get you the information
Thank you.
requested.
I'm sorry if it wasn't clear before.
No.
Next up is going to be the Honorable William Shiner from the State's Attorney's Office. Welcome this afternoon, and I think this is your first budget hearing before us, is it not?
Yes, sir, it is. It's a pleasure to be
Congratulations.
here. Thank you.
We're, for the most part, harmless.
Get ready for the hazing.
I've been warned. Thank you all for having me here, and I really appreciate what you guys have done. I love that building. I know that you were thanked last year for it, but I'll continue to thank you every time I appear before you because it's beautiful. And I'd also like to thank you guys for meeting with me earlier this year to go over some of my requests. So.
The state attorney's budget is $735,000 requested for fiscal '26. It's 100% funded through the Article 5 fund. It is a $254,000 increase over the FY25 adopted budget. That includes the request for an upgrade to their case management system, as well as a COLA for an employee that we currently reimburse. That'll turn it over to Mr. Steiner.
So I spoke to each of you all about the case management system and what that entails. It's a necessary function for what we do every day in the prosecution. This particular slide will illustrate what we're currently using is Stack 2.0. We're staying with the same vendor that my office has been contracting with for over 20 years. We looked at alternatives. That's that bottom right-hand corner. As you can see, those costs are cost prohibitive, $1.3, $2.3, and $1.2 million each in order for us to do that. We've elected for what appears to be a very efficient program, but is also the cheapest program that can be offered to us. The cost of that particular object to Stack 3.0 is being divided across both counties, for Seminole County and for Brevard County. So we have an additional equal ask out of Brevard County as well. So that represents that significant increase. That's why it's such a large jump. As it relates to the COLA, the increase for the FTE, that request is a hopeful request, and I say it's a hopeful request because we were anticipating that will mirror what the state gives all the other state employees to keep the one that you all fund in line with where the rest of our employees are at as far as raises go, because that's, if we get raises this year, that's where I expect them to be, is through COLA. So that's our budget.
Great, thank you very much. Any inquiries or questions? Commissioner Lockhart.
Thank you. And thank you for taking the time to explain those additional needs and why it's different this year, for sure. If I could have a little latitude in talking about the medical examiner topic, because it's very integral into what
Sure.
future budgets may look like.
Sure.
Of course, we're looking at a much larger picture than what necessarily involves the state attorney's office, but the funding of what may be next for us as Seminole County, if we are standing up our own facility or if we are partnering with others, or what that may look like remains to be seen. We know that we have said we're not staying where we are. And so in conversations with stakeholders, and I know you're just coming in new to that process, any insights that you can share with us from a cost perspective, or how we can share some of those costs at the state level, or any access to any funds that you may be aware of that are related to your prosecutions, perhaps. If you can, I'm not asking you to answer them now, but just know that I will be asking and thinking, and I'm sure our whole board will be wanting to learn as much as possible what financial resources there may be available coming from the state for some of your cases to help stand up that ME facility.
Fair question, and Commissioner Zembauer actually asked me that question previously, kind of put that on my radar. I have a meeting with Dr. Wolf either tomorrow, Wednesday, or next Wednesday. I'm not sure which one. I want to talk to her about that. I may be going through an ME search in Brevard County as well in the very near future. So all these questions are going to have to be looked at in that same vein. The one thing I can say is that I completely agree with all of you and the idea that we need to get out of our curtain situation that we're in, because that's cost prohibitive. We're paying more than our fair share and far more than the other counties are paying as it relates to those services that Dr. Wolf was providing us. But I don't have an answer to that, and I don't have an answer where those funds come. I can tell you that on the budget that I anticipate getting from the state as it relates to us, there's not a lot of additional funding, and in fact, we may very well be losing all of our due process funding that could potentially have been used for that. So I don't have an answer for you, and I think that that's something that we're going to have to sit down and figure out together, honestly. So,
Okay. Well, that's just
five months in, I'm mastering a $36 million budget. So, but I appreciate you putting that on my radar. It's definitely there, and Ms. Wood, my executive director, she's very much aware of it, and so is our fiscal director. So, it's all things that we're trying to figure out out and navigate, and I'd be happy to do that together.
Okay. Something that you mentioned, which is striking to me, is that you are a state attorney who oversees multiple counties, Seminole and Brevard,
Yes, ma'am.
correct?
Yes, ma'am.
And you have 2 different medical examiners and 2 different facilities that you work with on your cases.
Yes.
One of the items that has been presented repeatedly to me and to the entire medical examiner committee for District 5 and District 24 is that the other state attorney that is a part of that other district feels that it would be impossible, or I don't know that impossible is the right word. It is not preferred to have more than one medical examiner facility for him to be able to work with, and you're doing it now. So is that just a difference of opinion or a level of comfort between your state attorney operations and another state attorney's operations?
I can't really, I know that state attorney, and I've spoken to him a little bit about the ME situation. We're very unique here in the 18th Circuit that we take up, we are one of the few circuits, if not the only circuit across the state that has 2 counties that are their own district medical examiners' offices. There's one district ME designated for Seminole County, and there's one designated for Brevard County. All the other MEs are designated across their circuits the way they're assigned. And I think that that's why when the state attorney up there indicates that he's always had just one for all of his circuit, because that's the way they were assigned by the ME Commission. It's the only way I've known to do it in the 16 years I've done it, is there was one in Brevard and one in Seminole. Seminole has always been, as far as I can remember, a contract. We contracted with Volusia County for a while to do it, and now we're up there with Lake and Leon and all of them, or Marion, I'm sorry. You know, you do what you have to do to get by. I think that it's just a scenario where that's what we were given, and so that's what we worked with. You know, that may be something, if we end up in a deep ME search in Brevard County, that may be something the county commissions want to talk about across the river there with the ME Commission, to see if that's something that we could do, that Seminole and Brevard could unite in that regard. I'm not saying that's above me, but that's well down the road, I would suggest.
Well, I certainly appreciate your additional insight, because it is far more than a functional situation. It is a significant financial decision. So
Yes.
we'll be talking in great detail, I'm sure, as the years go on. Thank you. Appreciate your candor.
Thank you very much.
Anything further? Nope. I agree, and we appreciate your willingness to dig into some of this due process funding. And as you and I spoke, the unintended consequences of decisions that are made in Tallahassee that impact the taxpayers here locally. And I do think there is, up in the panhandle of Florida, I do think there are at least one other medical district that does have what we have here, similar between Brevard and Seminole County. But we appreciate your willingness to have that dialogue and do what we think is the best thing for the citizens and taxpayers of this county, which is why we're all here at the end of the day, regardless of whether somebody in another county believes it's the right thing or not. We're beholden to our taxpayers, not theirs. And I would argue that we are supplementing their taxpayers in at least 3 other counties in this scenario. So we appreciate you all very much. The final question I have is related to your IT technology and this ask, which I'm fine with. Moving forward, are we going to try to budget an annual cost associated with that so we don't get caught with this scenario?
Yes, sir. So this particular budget ask is over a course of a 3-year contract that we would sign if this was approved. So this would be a 3-year budget ask, and it would be that way going forward, and we would attempt to negotiate the similar rates going forward.
In out years, you'll continue to do, not knowing what technology may change and so on and so forth.
We're going to attempt as best we can to put it on your radar early and often. So
Appreciate it very much. Well, good luck in you made it through your first budget hearing.
Thank you.
Thank you very much for your willingness to collaborate.
I appreciate you guys.
it.
Thank you so much.
Thank
Take
you.
care.
Have a great day.
Good to see you guys.
Excuse me. Next up, we have our guardian ad litem, which is Amber Hedrick. Good to see you again.
You as well, sir. Thank you, all of you.
When you're ready.
So the Guardian ad litem budget is $165,000. The request for fiscal '26, and it's 100% funded through our general fund. The total increase is $8,000 or 5.1%. This amount is entirely generated through an increase for existing staff to health insurance and salary adjustments. There's no increase to the operating budget. The total FTEs are 2 in the department. I apologize for the typo. It's 2 FTEs for Guardian ad litem, and they're requesting no new positions. And that concludes the
Okay.
Thank
presentation.
you, sir. First, I wanted to say thank you for always supporting us and hearing me out. I don't think there's been a time that an email has gone unanswered or a meeting request has gone unanswered. Currently, just to give a little bit of an impact, let you know the impact that we're making in the community, we have 412 children sheltered from their parents' care in Seminole County alone, which we represent through our multidisciplinary team model. Our multidisciplinary team model includes a child welfare professional, a guardian ad litem attorney representing all the children using a best interest standard. With that being said, the Florida Guardian ad litem office uses volunteers, resources from the community, so we don't have to utilize the government resources as much. To help enhance this representation, we currently have 128 layperson mentors or pro bono attorney volunteers to represent these children who representing about 266 of the children in Seminole County. So we still have this great need of recruitment and retention in our office, and your support continues to help us with that, allows us to continue with that. We work diligently in the community for this recruitment so that all children have that enhancement, so they can hit their milestones within care and achieve permanency and normalcy while in care. The collaboration with community partners is intense. We are very active with the Children's Cabinet within Seminole County, with the Children's Alliance within Seminole County, as we continue to collaborate with community partners to improve the county systems within Seminole County. And again, I wanted to remind you all that I continue to be a resource for you. If anyone, any of the constituents have questions or welfare needs in the community. So, and again, I just wanted to say thank you for your continued support.
Thank you. Any comments or inquiries?
Thank you for doing what you do.
Yes.
Mr. Chairman?
I would say that the $165,000 is well spent for the return that we get for this community and for the taxpayers. And I will tell you that it's God's work, that what you all do, and we're very thankful for that, because you're making a little bit of money go a long way that impacts a lot of lives that otherwise would be very expensive for this county. So thank you very much.
Mr. Chairman?
Mr. Delory.
Thank you. Amber, you talked about the 412 children that you serve. First of all, the chairman's right. The dollars that we use in our general fund to help you goes a long way, and each child, you can't put a dollar figure on it. But what I'm curious about is the trend. Is the trend level? Is it going up or down? Or can you talk a little bit about the trend, please?
Yes, sir. The trend of shelters coming into care, when I say shelters, they're being sheltered away from their parents into safe care. They have actually been trending down. I
Okay.
will say the dependency system within Seminole County has strengthened, not only in achieving permanency within accurate timeframes for these kiddos, but in achieving normalcy for these kiddos while in care. With that being said, the prevention side of things has really stepped up. Our diversion programs, I'm sure you understand, we have a new community-based care. That transition, in my opinion, was as seamless as we could have made it. The collaboration and the partnerships that we have within Seminole County Dependency System are strong, and the support that we experience are strong. So, and that does absolutely 100% include the commissioners as well. In fact, sir, you're the chair of our Children's Alliance. You're there every month talking about this very topic, but the trend is down.
Thank you very much, Amber.
Yes, sir.
Anyone else? Seeing none, thank you again. We appreciate you being here and
Thank you for
again,
your
all the work you're doing. Next up is going to be our public defender, the Honorable Blaise Treatise, who's an old hat at this process. Welcome, sir.
Thank you. I've done it many years now.
The public defender's budget request is $267,500, which is 100% funded through our Article 5 fund. They have zero increase between fiscal year '25 and fiscal year '26.
Good afternoon, Chairman Zembauer and Board of County Commissioners. I am Blaise Treatise, the elected Republican public defender for Seminole and Brevard counties. I am pleased to ask for a budget that is what it was 8 years ago. This is my one prepared slide, and the tan bar is the actual budget of the Public Defender's Office. The blue bar represents a 1.5% increase in the technology budget, which reflects a Florida statute 29.008, which says there shall be a 1.5% increase per year, and there's some enforcement mechanisms in that. But I wanted to include both of those bars to show that the public defender budget has never increased more than 1.5%, took a big drop, about 25% in 23, 24, and today is what it was 8 years ago. So I've run my office effectively, cost-effectively, efficiently. I aim to continue to do that, and I thank you for your support of the office. I'd also personally like to thank Tim Jeck's budget director and Wendy Aviles, financial administrator, for the great work that they've done working with our office. They do an excellent job, and we have a great working relationship, and I appreciate that very much. With that said, that would conclude my budget presentation.
Very good. Thank you, sir. Any inquiries to the public defender?
Thank you.
Seeing none, keep up the good work, sir.
Thank you.
Thank you
Have a
kindly.
good day. Trying to get out of here.
Next item up is going to be Florida Department of Health, Dr. Ethan Johnson. Welcome, doctor.
Good afternoon. Thanks for giving me the opportunity to present. I will, in the interest of being as thorough and brief as the folks that came before me, I will probably skip quite a few of the slides that I have. But I will be thorough just because with the contributions that you all give, especially the contribution to direct services, it goes a really long way with all the things that we do at the Department of Health. So this is just our detailing our 24-25 budget year ending in June 30. We projected to end about where we ended last year. Not much of a change there. However, going into this new fiscal year, we do expect a slight decrease there, about a 5% decrease in our overall operating budget projected for this next fiscal year. That's about $670,000. We're experiencing most of our budget reductions in the form of state and categorical GR funds, federal funds, and environmental health fees, with the septic program transferring to DEP hopefully in the beginning of 2026. Specifically, that includes, outside of EH, that includes programs like TB control, STD surveillance, the refugee health program, and some of family planning. This is a 3-year budget trend, all that I'll note here is just we're already preparing for that shortfall. You guys approved us ending the lease at Reflections a little bit early because we're no longer using that space. Again, we're planning for the end of the septic program. We have done some workforce reductions for staff who are in positions that are no longer funded in STD surveillance or through COVID dollars. And then we're also have been able to reallocate some of our administrative staff's time to doing Healthy Start screening data entry for both Orange and Seminole County. What that allows is for us to use some of our general revenue or continue to use our general revenue for direct service provision here in Seminole and offset the cost of those staff salaries. So that's been helpful. So this is just a breakdown of Seminole County government's contribution to the health department. As I mentioned, the largest part is direct services, so that's kind of spread across all the direct services that we provide, and I'll go through those quickly, and then these other programs are programs that you all fund directly. I put this slide here just because I received just a few questions about the sites that the health department is located out of. Of course, everyone's familiar with Airport Boulevard. That's where all of our services are. Environmental health is right outside. Wick Castleberry, I wanted to point out because we do see about 3,500 unduplicated clients there every month, and that represents about half of our Wick population. We see the other 3,500 at Airport Road. And something I'll note here too that I guess I can note here for the WIC, we had a 17% increase in pregnant moms that are utilizing WIC, which is going to have a great impact on our mothers and babies here. We also have, since 2022, we've had a 41% increase in the WIC eligible clients actually taking advantage of those WIC benefits here in Seminole County.
And doctor, for the public
Yes, sir.
that may be watching this, the acronym WIC stands for?
Yes, sorry, Women, Infants, and Children. That's a federal supplemental nutrition program for women, infant, children, and families.
Thank you.
And Seminole County is one of the highest performing WIC offices in this part of Florida.
Great, thank you.
Yes, sir. Oh. So one of our core functions, is everyone's well aware of, is communicable disease. That encompasses all things reportable disease related. Your contribution goes to supporting this work. We've had a 10.5% increase in communicable disease investigations and a 17% increase in confirmed or probable cases. Just a few trends that are noteworthy. Rabies or rabid animals usually have like 2 or 3 confirmed a year. We've already had 3 in the first 3 months of this calendar year. So we do see that going up. There's also been a significant increase in pertussis cases. 2021, I think we had maybe 1 pertussis case. We've had 27 cases in the last year, but we are doing things to kind of address that through partnership with the school district. We did a TDAP clinic with middle schools and a few other initiatives like that. And then another trend that everyone's seeing across the state of Florida is mosquito-borne illnesses. So we're working on that. We have over the prior 3 fiscal years, we had 0 dengue cases, and then last year we had like 7. We also had our first locally acquired West Nile virus, which locally acquired just means hasn't traveled outside the state of Florida. So those are things that we're working on, and of course the county's great partners with mosquito control, emergency management, and so forth. A few things to note I already mentioned, and we've been saying and looking for the transition of septic, but it still is at the health department right now. This current year, we issued 200 new permits, 582 repair permits in septic, and that's in addition to the 2,100 or so inspections that we've done related to public swimming pools, school cafeterias, tattoo body art, mobile home parks. So a lot of things are going on there in environmental health. I won't mention everything, and I really loaded this slide up before I knew I only had 15 minutes, but this is the stuff that's exciting to me. This is just a lot of different partnerships throughout the community. We had an event recently, well, a few months back now, with the American Muslim Center. We were able to do 39 pap smears using the medical unit that you all support and fund. So we're trying to do more events like that, also with Teen Challenge, and of course we're out 4 times a week with the mobile unit. We've, with our Ryan White programs, federal HIV prevention program, we see currently we are helping 350 patients with outpatient medical care, prescription drugs, case management, and that represents about a quarter of persons in Seminole County living with HIV. And just a lot of other exciting things going on there. We do still have the partnership with the Seminole County Sheriff's Office for the sexual assault nurse examiner. Unfortunately, we did serve 36 victims this year. Preparedness, of course, there was a storm this year during Hurricane Milton. We did respond. Through our special needs shelters, we cared for 95 Seminole County residents in the special needs shelters. And something unique that our staff did this year after the storm, we've contacted all 95 of those residents to talk about their experience in the shelter, but also address some of the needs we saw there in terms of their, some of them were a little beyond the care of a special needs shelter. Some of them didn't have caregivers, and some of them just had a lot of other issues. So our staff helped address things all the way from stolen wheelchairs to folks who are vision impaired and no longer can read their mail. So a lot more coming out of that. So moving on just to the programs that you all directly fund, our diabetes and prevention education program. Since October, we've had 5 cohorts of that. We teach the diabetes empowerment education program. It's her name is DEEP. We also do community presentations. Since October, we've presented to about 166 residents. We're working with clinicians and private practices to get referrals for people that are at risk to attend the program. And then also through this program, we provide screenings for basic medical screenings, glucose tests, and referrals. And we're requesting for the same funding this year for that program. Same for the community nutrition program. Through that program, we taught 526 Seminole County students this year, and then we also used the 10 Tips for Adults curriculum and taught 127 adults. That's been a pretty impactful program in the community, and we'd also like to request the same funding for that program. The mobile health services program I've already touched on. We're doing basic screenings 4 times a week, and we're out in the community. When we actually take the whole clinic out there, we usually try to schedule that a little advance because we have to put one of our nurse practitioner or our medical director on there. And we do everything from adult screenings to pap smears to blood draws and everything else out there in the field. So we would like to request the same funding for the mobile health services program as well. The school-based dental program is doing really great. Last year, we were only able to go to 8 of the 12 Title I schools, but now we have the 15 schools, and we were able to go to all 15 this school year. We served 703 students and provided 3,903 services, which include dental screenings, prophylaxis, fluoride varnish, and sealants. And the picture to the left is actually in one of the schools. That's our hygienist working with a student. But the picture on the right is actually our fixed dental clinic. I think some people so I heard didn't realize we had the dental clinic in the health department. And I want to point out that the dental clinic is actually part of what allows us to sustain the school-based program under the leadership of Dr. Koenig. He's our dentist. The revenue generated there is how we're really able to be in the schools. But given some of the budget cuts and constraints that I mentioned earlier, we are requesting an additional $30,000 to support the school-based program because the general revenue that we're using to support the clinic will be shifted around. So it's not, what the extra revenue would allow us to do is to continue the services that we do in the school-based program, but it would also allow us to enhance the follow-up that we already do there and to improve some of the instructional materials that we provide. Right now, we don't really provide much of that in the follow-up. And then I'll end here with just some of the special projects. At the end of last year, or this time last year when I presented, I mentioned the ESOL and health literacy class. I did want to say we still do that. We're on our 6th cohort. We have 31 people in it. And it was actually just recognized by the National Association of City and County Health Officials as a promising practice. It'll be recognized in Anaheim, California this summer. And a few other special projects, I guess, that I won't go too much into detail for the sake of time. Although the last thing I'll mention, it's not up there, we do have plans this year to establish ourselves as an official milk bank drop-off location, which will be the only one in Seminole County. So we're looking forward to that. And I apologize for sprinting through all of that, but just trying to be respectful of time.
No, all good. Thank you very much. Start with Commissioner Lockhart, and we'll come across.
Thank you. It's been such a pleasure to get to work with you over these last couple of years. Even though you're not new anymore, it's just wonderful to have your fresh perspective and what you've brought from other counties to Seminole. Of course, you still have a fabulous team. Team's great. Love your team. Talking about the dental program, of course, that's been a highlight of discussion lately, and you've been incredibly helpful with bringing me some data that I hope we'll be able to get into a format that we can share with all of the board members about the Title I schools and comparing that data and talking about the fluoride discussion, of course. Dr. Johnson has tried valiantly to help gather data that will be applicable and useful and able to be used comparatively, and it's a little bit harder than we thought it might be. But with what we have, I think it's really good, and I want to make sure that we share it in a way that is comprehensive and understandable and good. That being said, I think your request for additional funding is completely reasonable from my perspective for that program. I was actually surprised it wasn't a little bit more. But I'm hoping that you'll be able to maybe start collecting some data so that maybe 5 or 10 years from now, when we're not sitting in these seats anymore and a county commission says, well, whatever happened with that? Do we know if that had an impact? They will have had the benefit of us collecting this data so that they can do a look back. Do you foresee including any type of data collection or study through this work?
So we do collect quite a bit of data now through the school-based sealant program as well as our school health program. So we can look at trends overall for the students that we see and oral health outcomes. The only problem is it isn't as consistent. Like, we don't see every student every year, so it's difficult to follow the student like some type of longitudinal study. But what we can, it is a way to kind of monitor what way oral hygiene is trending for that population of children from year to year.
Okay, all right. Well, I'm looking forward to continuing to work on that project because I think although we made a decision and a decision was made for us regardless, I think it'll be really important for our county to stay on top of that data and make sure that we're doing the very best for our children.
Mr. Constein?
And to just add on to what Commissioner Lockhart said, first of all, thank you, Dr. Johnson. It's always good to work with you. But I think that it would be important that when notice goes out that we are stopping that program, that we also give potential alternatives to the folks, especially those that can't afford the health care that some others can. And so if you could help our staff with that, I would greatly appreciate it.
Absolutely.
What program are we stopping?
What program is the health department?
Right.
I mean, fluoridation of
I thought
We
you were
already have that up.
Yeah,
We
that's
already have
already
that
done.
up, and
Okay,
so.
fine, thank you.
Commissioner Delory?
No comments, but thank you, Dr. Johnson. Thank you very much.
Commissioner Herr?
So I am struggling with the community nutrition program.
Okay.
And so I may be misunderstanding the numbers, but it looks like we've touched 526 people plus 127. And if I divide that into the 70, it's roughly $100 per touch.
So I don't have the number of courses in front of me. Those are the students that participated, but it isn't one touch. So it's,
All right, so I'm going to rephrase that. The number of people that were impacted is about $100 per person. And if I flip that to your dental program, it's about $5. And so I'm not going to say no to it, although I really do want to tell you to reduce the spend on the community nutrition and increase the spend on the dental. I think the community nutrition program is going to have to evolve over time because there's changes at the federal government level. And quite honestly, I don't know that teaching an elementary school student how to read a label when they're not the ones that buy the food is going to be helpful.
Right. So
There's lots of evidence about that, right?
Right, so the curriculum for the elementary school students is different from the one with the adults. I'm not sure that the label reading is necessarily a part of that curriculum with the children, but understood, absolutely.
Yeah, I mean, they eat what's in the house. They eat what we give out in the student lunches. We're not really impacting health with these types of programs. We need to do this holistically at the adult level to change that dynamic. So my feedback is that don't love that one, love the dental program. I would swap the funds.
Thank you, Dr. Johnson. My question is, have we refused or been unable to provide any dental services to someone that's come into the health department for those services? Are we running shortfall or?
If they're adults, so we only see children.
Understood.
But we haven't refused service. Most of the most of the children we see are on Medicaid, though.
Sure, okay. And have you asked the school for any funding?
At this time, I don't believe so.
Okay, just a general question. Well, thank you very much. Keep up the good work. Again, doing good community work.
Just one question, Mr.
County
Chairman.
manager
Thank you.
looks like he has a question.
Yes, so Mr. Johnson, Dr. Johnson, excuse me, we meet on a regular basis, and he's been keeping me up to speed on the septic tank permitting. I'm sure all of you have been briefed on that. I didn't know if you had any other information on it, but as you know, it's transitioning from the Department of Health to DEP, and I think we're in next
Yeah, we're
year's
supposed to be in
cycle.
the next phase. It's supposed to be March 2026, but the latest is July 26 per the 2019 Clean Water Act. So unless something happens in the spring next year, man.
And I'll just, so we meet regularly, so I'll be keeping the board updated on that.
Department of Health wants to get rid of that as fast as they can.
Yes,
Just some direction, that's all.
that's right.
Just a firm answer.
That's right. Well, thank you very much, sir. We appreciate you being here today.
Thank you for your time.
Have a great evening.
Thank you.
Next up is going to be Mr. Chris Ham from the Rescue Outreach Mission. Good afternoon, Mr. Ham. And we've got a couple of public comment forms, just so those are being patient. As soon as we wrap this up, we'll go to public input.
Thank you, Mr. Chairman and Commission. With me is Christine Schaefer, who's our Director of Shelter Services. We appreciate, again, the opportunity to come back before you. We were just here a couple of months ago. We want to address some of your questions and where we're thinking about. A quick thing I want to reemphasize that we talked about last time. We continue to remain, and I believe that we're the most cost-effective way of addressing those experiencing homelessness in our community. Our shelter costs are about $35 per night. When we compare that to a hotel of about $110, or our jail is $106. Our goal is to continue to expand our services and care for those in our need. As a reminder, we continue to serve the entire county. I want to talk about some of the increase in our services, and I'm going to turn it over to Christine to share some of these numbers for you.
Thank you. So as you can see, a lot of those numbers we presented last time, we went ahead and added in our first quarter numbers to that slide, and you can see a 4 to 8% increase. Depending on the economy, we are anticipating an increase in that percentage over the course of the next year. Please keep in mind also that these numbers do not reflect the hundreds of guests that come through our emergency cot program or do not receive services from us because they're seeking shelter and a bed is not available at that time. To combat some of these increases, we have increased our staffing in our case management and intake and diversion departments. And we are also working with other community partners and other organizations in the homeless sector just to make sure that we're able to connect the clients with services that we're unable to provide. Some of the questions that were presented in the last meeting were the clients that were coming to us, where are they coming from? Just based on that data in the last year or so, about 50% are coming from the city of Sanford, and 31% of the people coming to us are reporting that they slept on the street the night before. That does not include individuals that slept in their car. This is physically intense or outside on the street. The number of revisits that we're seeing, so in 2024, we had 733 enrollments into our program, and that served 695 guests, so we're seeing about a 5% revisit rate, so not terrible at all. And then as far as alcohol and substance use questions that were presented, so how are we serving those clients? Our lead case manager is a certified addictions counselor, and we also partner with Recovery Connections. It's a outpatient recovery program. They're on site with us 2 days a week. They come out and see our clients and provide counseling resources. And then we also do referrals for Teen Challenge and Recovery House. We work very closely with them. Our data from 2024 showed about 4% of individuals coming into our program reported alcohol use alcohol abuse, and 7.6% for drug use. As far as mental health is concerned, general mental health conditions, we are in line with the rest of the population at about 1 in 4. But as far as the severe mental health conditions, we're actually at about 3%. So those are your schizophrenia, severe mental health conditions that are going to prevent the ability to work a case plan, and live independently. This is actually much lower than what we're seeing for physical disabilities and chronic health conditions. Physical disabilities is about 16%, and chronic health conditions is about 18%.
Talk a little bit about some of our fundraising increases, and to reemphasize, these numbers do not include the county funding, the CSA dollars. This is strictly through our grants through corporations, faith-based individuals, and companies. And we're well on pace, as you can see as a reminder. We have had a pretty significant increase in our general fundraising since we really relaunched in 2022. We've had a 362% increase from then, which is pretty impressive, and we are on track. We are prepared, and we are going to be tapping into some of the reserves that we've saved in our current budget. That's only going to leave us, as we head into our fiscal year, which is January 1st, 2026, about 3 months of reserves. We think we should be a little bit higher. We'd prefer to be closer to 6 months, and we're working hard to stay at that level, but we are working through some of that. Our budget in 2026 is still projected. We're not expecting to see a large increase anywhere, but that really will leave us with very little in reserves with this year. And we're only 5 months into our own fiscal year. We are using our 2025 budget revenues instead of actuals. We do think we'll have another 20% increase in fundraising, so we really think we'll hit over $1 million next year. We think our expenses will be around 1.5. A big part is we're very cautious, as we all know, with the economy, with the rise in increases in insurance and food costs, and also the increase in salaries due to the increase of the minimum wage. We're having to kind of keep up with that. And we're also curious and cautious about what's happening with some of our partner agencies. We're still not sure. We do have a tentative agreement with United Way for some federal HUD dollars from the Emergency Food and Shelter Program, but that is on hold. We do not know how much that is. We know that a total of about $170,000 or $180,000 is coming to Seminole County, but we don't know what we're going to get, if we're going to get anything, because that's on hold. Sometimes we'll get 20 to 60 to 70. I've asked, because my righteous indignation will go up the more that they offer me. If we're up to 70 or 80, I'll get a lot more angrier and be on the phone versus 20,000. That's the HUD dollars that we might be getting.
Oh, I'm not confused by what you're saying. I'm
Yeah.
confused by how you're saying it.
Sorry, yeah, if it's $10,000 or $20,000, I may not be as sort of pushing to get that through as if it was 80 or 90,000. So we are still going to be asking for about $400,000 in CSA or county funds. Questions you guys had last time that we wanted to make sure we addressed? I was asked about quantifying the sheriff's office support. The sheriff's office had sent over one of their managers, you may or not remember, Bernard Johns. He went back to the sheriff's office in '22. We still regularly communicate. We still regularly collaborate In fact, I recently went and spoke with the sergeants. We continue to meet with Mr. Gray and Ms. Johnston on a regular basis. We were asked about the buses that they're looking at in the Orlando area. They are still under construction. They haven't mobilized them yet. And the last time I spoke with the folks down there, they are still not sure where they're going to park those buses or how those are going to fully be operational. Those were converted Greyhound bus type buses that will house about 20 people per bus just for the night. So,
Inquiries? Start with Commissioner Hurt, work our way across.
I think I probably should go last since I'm the board member on the...
Okay. Any inquiries?
Yes, Commissioner. Chris, I asked you last time for a couple of the 2 years' worth of budgets. I've not received that yet.
okay.
If you can get that to me, I'd greatly appreciate it.
Commissioner Lockhart?
So I didn't have the benefit of being here for that last meeting, and so I went back and watched the video, and so I could kind of get up to speed on some of the different items. And in the meantime, I took the opportunity to reach out to a couple of other homelessness providers in the region, just to talk about, to better understand from my perspective, typical budget reserves, expenses, budgeting, how, tell me what the norm is so that I'm looking at it from a more holistic perspective and not just in the tunnel of this particular topic. And so I learned quite a bit through those conversations. And I'm going to ask you for the same thing that I asked the other constitutionals. It is noteworthy. I know it's a timing issue, but it is. I don't want anyone watching this to think that we are obligated funding ROM like we are with the clerk of the court and the public defender. Like, this is just a one-off that you happen to be here today. So I would just want to put that on the record for sure. But so I would love to see the budget to actuals line item for your organization. I think it is, this is the first time in my recollection that any nonprofit has come to us asking for, if needed, maybe possible type funds. I'll use as an example, we got an email from Meals on Wheels a couple of weeks ago because they're having some funding concerns with federal dollars going away, and so they sent an email to us like, here's our concerns, this is what might be happening, this is our plan, we want to keep you apprised. And I understand you are an emergency shelter. We do have other emergency shelters. Safe House is an emergency shelter, and I know you refer clients back and forth to one another, but this is very uncharted territory for me to have a CEO of any of our nonprofits be asking for budget dollars because we might need it without a specific outcome-based request. We need $100,000 for a case worker to do whatever. We need, it's odd. And so I'm not saying that you don't do good work. I'm not saying that the county shouldn't increase our overall homelessness allocations, but having one entity come and ask for a general amount of money to go into almost like a line of credit type scenario, we may need up to $400,000. It's the first time this has ever happened. And so I'm struggling with how to approach it because I see the need, but I'm not sure that we're necessarily the ones to be asked to be filling it. So I'm struggling, and I'm just being very candid because I don't want anyone to say that I said one thing and did another at the end of the day. And if you could please, we don't need to be lobbied. I don't need to be lobbied. Please make the phone calls stop.
Okay.
Commissioner Constantine?
Chris, last time you mentioned the homeless bus, and this was just something that I wanted us to keep an eye out for because I thought there was opportunity there. But you made the comment or on your screen that it was $74 or something like that, and you were $32 a night. And then you came back to me almost the next day, and I also had checked that with Eric Gray, that it was more like $30, and you said you were going to reach out to the others and confirm that or to change that because you had said it was 74. And I just want to make sure that happened and that it is,
That 74 is what was reported in the Orlando Sentinel.
Right.
And what Eric and I had spoken about is, he said that also includes additional case management and some rehousing dollars. And so
Which
he
would
said,
have happened anyway.
and he's like, we're not even sure yet how to operate this. In fact, I'm probably going to come visit you, Chris, because I've never operated a shelter before. And he's like, we're going to come up and visit to see, and they don't know how the cleaning's going to go, so he's just not 100% certain what that's going to look like. Is it a long period of time? Is it one-offs? He's not even sure yet, last time Eric and I spoke.
And it's always good to see all these organizations cooperating, and that's all I would try to get to. Thank you.
I already gave my comments.
Commissioner Herr, as the board member who sits on that board, has requested to go last. There may be some additional comments or inquiries once that happens. My input is based on a couple things. 50% of your population is coming from the city of Sanford. How much have you asked the city of Sanford for?
We have been in conversations with them about additional funding. They are still awaiting their HUD CDBG dollars. They haven't been announced yet what they are. We have received a grant from them for public facilities. We received about $100,000, and it helped us upgrade hurricane windows, hurricane doors, other facility upgrades. And when people say they're from the city of Sanford, it's sometimes a little challenging because they think the city of Sanford, they're not sure where the city lines overlap. From city of Sanford, Lake Mary, it's all, for a lot of folks, or where they were in their car last night when they're walking because they're in Sanford.
Sure. So I heard clearly what your anticipation is getting into the reserves and what your first quarter of next year looks like. What I didn't hear, however, was fundraising plans. Do you have a calendar of upcoming fundraisers and any new fundraisers? In essence, what is ROM doing that they have not been doing for the past 2 to 3 years in carrying that up a notch for additional fundraisers or sources of income other than the county?
Yeah, so kind of look back there, you can see the increase, which, to be honest with you, is, if you may or may not know, when I walked in the door, my donor development fundraising was a piece of paper with 4 names. And I came from an agency with about 21,000 names in their database. So we have grown that significantly. We have a dinner on August 6th at Talk of the Town at Fishbounds. We'd love to have you come join us. It's $125 a person. We're also hosting a fundraising luncheon. Chairman Zembauer, we'd love to have you be a table captain to invite your friends. It'll be in October.
Just tell me you want me to write a check. It's much
I'm headed that way, yeah. So we are continuing to grow.
Let's not sugarcoat it.
Yeah, I'm not sugarcoating it. I was giving you those dates. So we're continuing to increase those. We're trying to increase all of our buckets. We really believe it's a fourfold. We do think that government should have a piece. This is important as citizens. These individuals that are sleeping on the streets are citizens we need to care for. We do think that the government should have a piece of it. We would love to get some assistance with the cities. We do think that individuals and corporations and our faith communities need to continue those work that they're doing as, we're reaching out to them.
Sure. So we have a community needs assessment review that our folks do here at the county. And for me, it's about the needs assessment and which and how many of these charitable organizations are doing the most work for the least amount of dollars and making the biggest impact in the community. And I think that's the reason our community needs assessment was put into place several years ago. And again, I argue it doesn't make sense to give a lion's share of dollars to one, no more than it makes to give a pittance, if you will, to 8 different organizations. We need to be focused on those organizations that are doing the best work in the community most efficiently, impacting the most people. And I think for me, it's about allowing our community services people to do those analysis and report to us what that efficiency is and the best work that each of these are doing through the community, and present us with a scorecard of, we believe this organization or that organization makes a significant impact, and we suggest you fund those. So I'll be looking forward to our community services input, on these kind of matters, as I always do, because I value their input. They're the folks that deal with the dollars coming in. They're the folks that deal with the individuals that have needs many times, but they're also in close interface with the charitable organizations that are doing the people's work out there. So that's what I'm in need of. So, Commissioner Herr.
So the reason I asked to go last is because I was a little bit worried that this was going to happen. First of all, I want to explain why Chris is in this environment. It was certainly not his idea. I'm sure it wasn't Christine's idea. We asked them to do this. This came through the county manager's meetings. County manager and Tricia Johnson have been meeting with Chris ongoing. And that was in response to this board saying, do not surprise us with an imminent potential shutdown or turning away of potential people that could be on the streets in light of this new camping gig. So that's why it's here. He's here. I think this is a little bit different because it is the only open shelter. There are other shelters, but you have to meet a narrow qualification. There are other services, I see Michelle Smith here, that help with diversion and impact and all of that good stuff, but they're not heads in beds. And so that was the request. So the other piece of this is that the reason why the request is open-ended is because the goal is not to have a request. But we wanted to know in advance what the potential number could be in line with the budget cycle, and that's why they're here. And so I think, Commissioner Zimbauer, your response is a good one in that we need to be looking to community service for guidance, et cetera. And I will also point out that at the point, I think it was Commissioner Lockhart was on the board, then Commissioner Zimbauer was on the board, and then I was on the board, and the place was close to shutting down. I think you all made a decision before me getting here that you didn't want to shut it down. I think there was debate as to whether the county should take it over. That happened under the former county manager, and the cost will not be that cost structure if we take it over. It probably doubles. And so we need it to be viable. That's why we're here.
So to address some of that, just so we're clear, I was sent there by the then chairman, Commissioner Carey, just before COVID, when it was off the rails.
Oh, yeah, it was off the rails.
Totally off the rails. And Commissioner Carey said, well, you're a businessman, we're going to put you on there and go figure it out. Well, that was a real interesting journey in figuring out the books, the finances, and the things that were going on, and a whole lot of other things. And then we've slowly stood it back up during the major funding request that the county did. The county was doing everything during COVID and post-COVID to try to stand it up, and the whole premise of that, stand it up so it can stand on its own. So I think the real question for this board is, how long are we going to continue to fund it till it stands on its own? This is now going into, well, the budget year will be in the 7th year. And if it hasn't been able to stand up by itself right now, then maybe there needs to be some very raw, honest conversation. Maybe there ought to be another nonprofit that should be coming in and looking at this and running it, or assisting in running it. Because obviously government is not the right entity for so many reasons. And it was always stated, even when I was sent there by Commissioner Carey, was we wanted to respect Mother Weaver's true intent and did not want the county to come in and change all that up and lose that original mission or upset the faith-based group of Mother Weaver's folks that somehow this was a county takeover. We did, through contractual arrangements, make sure our taxpayers were protected by putting things in process that if something were to fall off the rails, the taxpayers would have the ability to have those properties to do something with, either liquidate or bring somebody else in to run it. So it was always the intent, and the intent I was always given, that our goal was to help them stand up and do their thing. But again, here we are 7 years later, so I think really the question is, what is it we want to continue to do? We want to continue to help it stand up on its own, or will it ever be able to stand up on its own? I think might be the real question.
So I think the answer to the question is yes, it will be able to stand up on its own. And I think we've accomplished all of those things. We've honored Mother Weaver's original mission. We've stayed in good relationship with the faith-based organizations, which, by the way, give very little money and have historically given very little money. They have very little money to give, those faith-based organizations. We've branched out into others. There was also a request, and this can't be ignored, and I think this came from you, Commissioner DeLaury, around do not surprise us.
I've always said that.
Which was a legitimate request, and that's why we're here.
I've always said that about everything we do up here.
Right.
And we've all said that.
Right. That's why we're here.
We don't like surprises.
We don't like surprises. Particularly, we're not going to feel good about ourselves if this slips and we're not serving
And Commissioner, that's the reason
folks.
why I've been asking for the budgets.
Yeah.
And yet we're surprised on a daily basis.
Yeah.
Not necessarily this, but anything. Commissioner Lockhart.
Yeah, and I think there's been some hesitancy to share some of the detail of the budget. And I think maybe some resistance and maybe even some offense has been taken at the request of the budgets being requested. But we're not being, if another nonprofit came and asked for this amount of well, it's not open-ended, it's up to $400,000 for something. I would be asking the same of them, because if you're in that type of a financial situation that is that imperiled, that you are using the county as your backstop, then I'd like to see the details of money. I know we don't want to live in the past, but I think it is important to point out, when I was on the board of ROM, we lost a very long-time donor, significant donor, because the county government had stepped in and was giving more money. And they said, well, if you've got government funding, you don't need my money. And they left and they took their money and gave it to another organization in this county, which, by the way, is also asking for more government money. But I think we need to Commissioner Zembauer's point, talk about what this board wants to allocate toward the homelessness crisis in this county, and look at that dollar amount and see what that is based on the input from our professional staff, and give those resources as we can, and not start cherry picking individual organizations. And I think that was why that CSA process and this community needs analysis was created, was exactly for that purpose, so that there was a metric, there was a, and you know, there is no doubt that this government, and Chris, I will take exception, because the implication was that somehow local government is not contributing to the needs of homelessness, or we don't have, I think you kept saying government needs to participate, or you have a role. I think we know we have a role, and I think we do participate significantly. And I kind of feel like that's not being recognized much for some reason. I don't know, that maybe it's just my impression, but we need a bigger, broader plan, because the needs are not going away. And we're not going to solve it today, for sure.
Agreed.
Commissioner Delory, you had your hand up.
Yes, I did, and Commissioner Lockhart was correct, and I can't really tell you the date, I'd have to think about it, but it was a number of years ago that all the nonprofits would line up during the budget hearings, and they would do the request and the ask, and it would all be how much, and the board would start discussing different needs, and it got to be who knew who and who had the biggest voice, and I know that some of us were here at that point. And then we made the big decision at that point, and I can't tell you the year, but I'm sure staff could. Tim may be able to.
2023.
No, it was before then. It was way before then.
I was a staff member.
No, it was way before.
It was way before then.
I wasn't there.
I know you weren't, but
No, that's what I was saying, it was way before there, yeah.
we actually put a process into place where we set the criteria. We put together a total dollar figure. Staff did the needs assessment, and they made recommendations. And there was an actual process, and that's what we've been doing for many, many years. And then there's been times that the overall number went up, and there's sometimes an overall number went down. And what we discussed up here was the overall number. We never discussed individual 501c3s or charitable organizations. We never did that, after that date, whatever that was. And I know we've asked staff to look at that, and they have. And I know at the last go-around that we've actually done earmark dollars for shelter beds. And there's 3 organizations that actually get direct money from the CSA, and then the rest of it gets divvied up. We all work with nonprofits. There is so much need out there, depending upon what you're looking at. It has to do with adults, it has to do with elderly, it has to do with homelessness, it has to do with children. And you picked a topic, the need is out there. You pick the topic in the organization, I can tell you the state and whoever organization they report to is cutting funding. And I can tell you every which way possible, every year, there's less and less money out there that people are looking for more and more money. And it's just the facts. You all know that I sit on the Kids House Board, and it's, how much money we're losing this year. And it's not that we're losing because we're misspending it, we're losing it because we're not receiving it. Or what is the issue now is that the state hasn't approved their budget yet. We don't know what's happening in the state. And so there's a lot of missing pieces to this, and a lot of pieces that we're very fortunate that we have a phenomenal group of our county staff with Allison Thal and her people. And they actually get really into the weeds on a day-to-day basis to help us make those decisions. Whatever we decide up here, it needs to be factual, it needs to be based on need, it needs to be professional, and I really think that we need to be asking our staff to take not just the leadership of it, we can give the policy direction, but they need to be able to tell us where the real need is and how we should spend the precious dollars that we have, because even in this economy, general fund dollars are getting harder and harder to get, as we're going to be discussing in the next couple of weeks. And yes, would I love to fund you, Chris? If I had the money, I'd write you the blank check today, but I don't. I'm sure all five of us or 7 of us would do that. I'm including Darren and Catherine. But I mean, it's all based on need. It's all based on what we have. And I'm not saying we're not going to do something. All I'm saying is that we need to look at it holistically, and we need to go through our budget process to see where we're getting our money from and how we're setting our budget. Because as we all know, as we move forward to that magical trim notice and that magical budget approval in September, there's going to be some hard discussions that we're going to have about where the dollars are coming from and what are we spending them on? And that is the end of my discussion.
Commissioner Lockhart.
Mr. Gray, could you and your staff look at that formula that we use to distribute based on beds or whatever it is, and maybe it's the base allocation to that overall formula that needs to be increased, rather than, I don't know what the answer is, but maybe that's a possibility.
That's a good idea.
I don't know.
Yes. Yeah.
Can I elaborate on that, if I may? Because there's 3 different organizations. Are we getting the right bang for the buck from those 3 organizations? You know, there's 3 different organizations we give.
I think staff should be able to help us answer that.
Yeah, that's my point. There's 3 organizations we give shelter beds to.
Oh, yes,
Yeah.
yes, okay, I'm with
That's
you
what I'm
now.
getting.
I was like, no, there's a lot more than 3. You're talking about 3
Just shelter beds.
Shelter.
Right, well, and, I will say, we are our own shelter bed organization in the sense that we pay for a lot of hotel nights.
I understand that.
So I'm just saying, like, the shelter beds aren't the only beds that house homelessness with county funding. We spend a lot of county funding putting heads in beds in hotels.
Seeing nothing else, thank you all very much for being here. We appreciate it.
Thank you.
Right now, we're going to move to Mr. Jex, who had his earlier presentation pushed and rearranged.
Give me one moment to get the slides from this morning.
Sure. While we're waiting on that, do y'all want to take, we've got a couple public comment, folks. Do you want to take any?
Take a 2-minute break.
Let's bring down, we got 2 individuals that want to speak this afternoon's meeting. If you'll come down in the order that I call them, Ms. Michelle Smith and Mr. Jose Boscan. And I think, is there anyone else here that desires to speak on today's items? Seeing none?
Well, good afternoon, all. I appreciate being here today. I am struck by these conversations today, and I'd like to lead with that, because all of these discussions relate to budgets and funds available and how it relates to organizations like mine, a 501c3. I come to you here today, my name is Michelle Smith. I'm the board chairman for the Sharing Center, and so I would like to make voters aware that amid these funding discussions, you guys have really done a good job of resisting raising taxes for the last 7 or 8 years, if my math is correct, but I believe it is.
It's correct.
You resisted during COVID, and then again since, to help Seminole County thrive. Here at the Sharing Center, we recognize that and we appreciate that. Serving the most vulnerable and homeless neighbors with dignity and compassion, the Sharing Center is Seminole County's largest provider of comprehensive social services. We have 5 life-changing programs: our free pantry, food pantry, and emergency financial assistance, keeping people in their homes; Project Rise, delivering showers and laundering services; the Oasis, providing showers and laundry services, and more to the homeless; Project Rise, delivering life skills, education, and employment preparation. Everyone that we have, that we access, everyone that we serve has access to free mental health services as well, with licensed mental health counselors. And now we are actively developing a first-of-its-kind workforce affordable attainable housing initiative to address our region's housing crisis, breaking ground fourth quarter this year. It has been at the Sharing Center leadership's intention to be a good partner serving Seminole County as a good steward of our responsibilities. So I'm here today as an ambassador and an advocate for the Sharing Center. We have tried to be good stewards, making sure that we can financially support ourselves and to continue providing services for those facing those life catastrophic experiences. We've done that for almost 40 years. The Sharing Center has a track record of requesting funds only as a vessel for state and federal-sponsored projects so that the citizens don't pay for this. In fact, we have not requested money from your general funds. So your investment, I'm here to say that as one of the county's partners helping those in catastrophic situations, we've been good partners, and your investment in ROI in the citizens, for the citizens, is one that you can take pride in for the community. My concern is this, the hard truths. You have some very difficult decisions coming, and I know that. With the cost of living and everything else in our lives increasing exponentially, you will continue receiving fund requests from all sorts of organizations, some smaller, and you will be tempted to help everyone, but you can't. In fact, some monies may only serve, for example, in a smaller organization, to make someone's payroll, as opposed to organizations that put food on the table for a month, that keep someone in their home from being homeless, and for someone receiving free mental health care. My request is this. Please take this into consideration in the budgeting process for you all. I've brought also an impact report from our most recent fiscal year, and am happy to answer any questions that you have. But again, I'm here as an advocate and an ambassador for the Sharing Center to let you know that we are trying to be responsible and just a good partner in solving problems here in Seminole County. So we appreciate your support.
Any questions, inquiries, comments? Well, we certainly appreciate you being here and sharing your perspective.
Thank you.
And I know that I've watched you and Mr. Boscan sit back there for an extended period of time. We're truly sorry, but we've done it pretty efficient, but we appreciate your patience in being here.
Absolutely, happy to do it. I've brought for each one of you our impact report. I'll leave it here so that you can refer to it in your free time. So thank you all.
Thank you very much. Mr. Boscan?
Thank you, Mr. Chairman, Commissioners. I'm Jose Boscan, Manager of Government Relations for WM Waste Management.
And your address, please?
I'm at 3510 Rio Vista Avenue, Orlando, Florida, 32805. That's my office address. I wanted to share with you about, we made an investment of $18 million to our Brevard MRF, and that may impact positively the county's budget because we are now processing more of your material, additionally 300 to 500 tons of your recycling material on an annual basis. We do about 21,000 is your estimated tonnage, and that increase keeps that from going to your landfill, and it just shows how great our relationship is with Seminole County and your staff and your residents. Continued great job and doing the best. You really have the best material, recycling material in Central Florida.
We have great trash.
You have great trash, and
That's why the Bears always came to us first.
That's right. That's right. So, I wanted to just share that with you. It's going to probably see a future impact in budgets. We're also going to invest probably in another facility in Central Florida. We're looking at that, which also could be beneficial to the county once we do that. And I'll come back and share more information about that in the future, but I just wanted to share that with you. And thank you for your time, and thank you for your indulgence, Mr. Chairman.
Thank you, Mr. Boscan. We appreciate it very much. Be well. Okay. No other speakers? And we'll close any public comment. Mr. Jex, you good?
Yep, I'm ready.
It's all yours, sir.
Thank you, Chairman and Commissioners. For the record, I'm Timothy Jex, and when I'm not working on microtransit, my day job is the Director of the Office of Management and Budget.
Jim, pull that mic again. Yes, all right, up to you.
Mr. Chairman?
Yes, sir.
Before Mr. Jex gets going, and I think
Mr.
we've all had preliminary discussions with this and the county manager. As you all know, I have to leave in a few minutes, and I just wanted to say I'm looking forward to the continued discussions of this, but I have been, as all of you have been briefed, and I just want to say I know the tough decisions we're going to have to make in the near future, and I do want to thank Tim, for such a, yeoman's effort in getting us to this point, and look forward to all the opportunities for what investments and revenues we can find to balance this general fund budget that we have. But I'll stay for a few more minutes. I just didn't want anybody to think that I was so disgusted with the numbers that I just had to walk out.
All right. Thank you, Commissioner. Mr. Jex, please proceed.
Today, we're doing a brief update, overview on the general fund. We're still working to finalize the county manager's proposed budget for all funds. We're planning to deliver that to the board at the end of the month.
Tim, if you could bring the microphone a little closer.
Sure.
You almost have to, like...
Got to be on top of it over there.
Gotcha. Thank you. So today's presentation will be going over base revenues in the general fund, constitutional officer budget requests that we've already received, the current status of the BCC budget development process, one-time revenues, reserves, and a millage history slide. These are the base revenues that make up, the top 5 lines show the revenues that make up 94% of the revenues in the general fund. You see 77% of them are ad valorem property taxes, 9% half-cent sales tax, 4% state shared, and 3% utility tax, and 1% communication service taxes. These are revenues that we're able to project over time, and we have a good amount of confidence as to what the revenues will be for fiscal year 26. So the first is our largest revenue in the general fund. It's ad valorem property taxes. This revenue we updated this morning based on the property appraiser's estimate of 6.5% growth, and that will generate an additional $16.2 million going into fiscal 26. Half-cent sales taxes is our second biggest revenue in the general fund. You can see they peaked in fiscal year 23, around $31.6 million, and have declined slightly since then. We are projecting a small increase in fiscal year 26 and a revenue of approximately $30 million. State shared revenues, this is another sales tax generated revenue. It peaked at $15.5 million, and we are projecting $13.4 million in fiscal 26. Utility taxes is the most steady revenue in the general fund. We had an increase in fiscal 23 of 9.4%. Otherwise, we typically see 2 to 3% growth, and we have $9.6 million projected for fiscal 26 based on the county's current 4% levy. Next, we have communication service taxes. This is a revenue that has been falling since fiscal year 19, and we're projecting about $5 million in fiscal 26. So this slide shows the total base revenues, not including one-time revenues for the general fund, totaling $347.2 million for fiscal 26. An important thing to note, when you look at the FY25 total budgets, which include a one-time revenue of $4 million, which will not be received in fiscal year 26, we'll have about $12.7 million of new revenues to work with going into next year, and that's a 3.8% increase in general fund revenues. Moving to expenditures, we have received, as of May 1st, requests from all of our constitutional officers. So we'll be going over the sheriff's budget in June. But they are requesting a 9% increase, $16.2 million. And if you go down the line, total budget requests that will be allocated to the constitutional officers are growing by $18.8 million. The $230 million fiscal year 26 request is approximately 66% of the total general fund revenues. 66%. And this slide shows the growth since fiscal year 19. Up to the $230 million. So, as I mentioned, we're still under the process of developing the BCC department budgets. We received the request from all of our departments in March, and then we worked through March and April with the departments. We had lots of meetings to minimize the increases as much as possible. And this slide shows the groupings, how we kind of review and go over the budget. So we have mandates, obligations, and current commitments. This includes unfunded mandates. The total amount of this group is about $70 million. Unfunded mandates, just this section here, is about $9.7 million. And when we present this budget to you, you'll see that there's really not much of an increase at all going into fiscal '26. These include costs that are mandated for the county to perform but did not receive revenues to offset. Next, we have obligations. This budget, as it stands today, still being developed, is around $39.5 million. This includes debt service, contributions for CRAs, our Sunrail obligation, and then the service required to maintain the county-wide public safety 800 megahertz radio system, property liability insurance for county government buildings, and then power and water utilities that we pay to keep county operations running. This slide shows our current commitments. These are Seminole Forever CSAs, which we have budgeted at around $850,000, contribution to attainable housing, links and microtransit services, and finally judicial support. Next, we have our BCC base operations. This includes personnel and operating budgets to support the 10 departments that you see here that are within our general fund. As well, we have a transfer to our transportation trust, which supports our public works department. There's currently 629 FTEs in the general fund. We're not proposing any new positions. In fact, we're proposing to eliminate 10 FTEs for positions that are retiring that we're not planning to refill. The personnel budget for BCC operations is $62 million, and the operating budget's around $10 million. This totals 21% of our general fund. Next, we're showing project budgets. This is the section of the budget that's most under development, that needs more time to finalize before we put together the proposed budget. We broke it off into two categories. On the left, we have annual project needs. These are capital expenditures, but these are required to maintain like our fleet, our facilities. We have library books and IT equipment, like network equipment. On the right-hand side, you have costs that are more inconsistent, the expenditures that have to be made every 5 to 15 years. There's not a whole lot of capital in our general fund. We have our sales tax fund that pays for transportation costs. These are the capital expenditures that our general fund is responsible for: our CAD dispatch system, our public safety radio towers, our portable radios, of which the county maintains an inventory of around 5,500, and then equipment at our tower sites. I wanted to show this slide just to indicate how important it is to maintain the annual fleet replacement. This is a budget that when revenues get short, this is a budget that's easier to defer. The top two rows, the general fund and the transportation trust fund, have impact on your general fund revenues. We have about $52 million worth of equipment in those two funds, and it includes heavy equipment, light fleet, work trucks, generators, trailers, and emergency vehicles. And that $1.5 million annually is a fairly minimum amount of replacement. Next, we have facilities. The county facilities department maintains 341 buildings, totaling 2 million square feet of interior space. Approximately 82% of those square feet are dedicated towards general fund activities. We have 800,000 square feet of roofs, 1,000 HVACs, air handlers, boilers, and chillers, and we're recommending a minimum of around $2 million in maintenance projects to maintain these buildings. We wanted to show quickly a chart on one-time revenues. The county total over the last 7 or 8 years has received $82 million. But if you look from fiscal year 22 to fiscal year 25, we received approximately $80 million in one-time revenues. The FY25 beginning fund balance that was amended at the recent mid-year BAR is $102 million. So you can see about $82 million of that did affect the beginning fund balance that we have in our general fund. And in fiscal 26, we aren't budgeting any new one-time revenues. This slide just shows statistically, we haven't finalized our general fund budget, so we don't have the current reserve amounts. But if we wanted to maintain a 20% reserve for fiscal 26 based on the current revenues, we'd be around $69 million. And the 2-month reserve, which is the GFOA recommended best practice, would be around $55 million in reserves. And finally, I wanted to go over an important slide around discussion on the general fund millage. So my records go back to fiscal year 91, where the general fund millage was 5.4146. Over the next 10 years, it reduced down to 4.9989 mils, where it remained until fiscal year '07. And then in fiscal year '08, there was the property tax reform, where the millage was required to be reduced and went to 4.35 mils. In fiscal year '09, there was a roll forward where property values decreased and the millage rolled forward to 4.5 mils. In fiscal year '10, the board did increase the millage to 4.90 mils, which was below where it was prior to the reduction. And then in fiscal year '11, the board set the millage at 4.8751 mils, where it remains today. So today is May 20th. It's our second budget work session. As we mentioned, we're planning to publish the county manager's proposed budget on May 30th. We'll have briefings with the board prior to the June 17th work session, where we'll go over county departments and a few of the other agencies that couldn't present today. On July 22nd, that's the regular board meeting where we would set the trim. And then July 29th, we do have a work session scheduled. It's an as-needed work session. And then we have our first and second public hearings in September. And that concludes my presentation.
And Mr. Chairman,
yes.
Thank you. And so I just wanted Mr. Jex just to give the overview. We showed you this back in March, at your retreat. I wanted you to see it here when we discussed our constitutionals. We're going to be meeting with you, all five of your commissioners, over the next couple of weeks to the next month before this June 17th, probably a couple times. I am going to be submitting to your recommended budget by the end of the month. However, there will be certain scenarios that I would like to discuss with all five of you individually, and so that when we come here in June 17th, that we've talked about it for the last 6 months, and that we've seen. You know the picture. It's the same. The only thing that's changed from March to now is that we have some updated numbers from the state, but they're the same projections that are around the same projections that we thought. So I just wanted to give this picture to you one more time as we start working through it. I really want to thank those departments. We have done amazing work, I believe, over the last couple of months. Not only once did they submit it, we sent it back to them 2 or 3 times. Mr. Jex has really been working with them, as well as Tricia Johnson in my office and Christian Swinson on their departments. And you're going to see the departments that are coming through that are going to have flat budgets. We're not requesting from the board any new positions in the general fund. We've actually found areas that we can combine. As you have saw the Seminole Moments piece, you're going to see that come through. The microtransit that you saw, we are going to have we're going to be recruiting 2 positions to help with that, but we're using existing resources. We're not asking to increase the budget, the general fund budget for that. We're using existing funds, not even the savings from that we possibly will get. So we are uncovering and looking at everything in the general fund. I want, when you become at the June 17th and you'll have that recommended budget for at least a good 3 weeks to 3.5 weeks before that June 17th meeting. We're available to meet anytime all through that over the next month to discuss with you, because I want to make sure you have all the information, materials, thoughts, and other research that you want us to do prior to that.
Fair enough. I think that's probably going to be a good thing, because based on what we're hearing and what we've seen now for several months, and as Commissioner DeLaurie indicated earlier, I think we've got a lot of tough decisions to make on behalf of our taxpayers, and so it's going to be important we understand what that fixed hard overhead is, and what that leaves for any additional services. And for me, it's going to be about, if you have to cut, where are you going to cut any further than what your own Doge or mini Doge efforts have already undertaken. I think it's going to be valuable. We'll start questions for Mr. Jex. Commissioner Lockhart?
Yes, and Tim, I don't know if this is me misreading this or if this is just amazing happenstance. And the general fund ad valorem slide, that is
After the base revenue, there you go.
Yes.
Okay, so the projected increase over last year's revenue is 16.2 million.
That's correct.
Is that right? Am I reading
Yes.
that right?
Yes.
Okay. And then when I flip to the constitutional officer budgets, the sheriff's adopted variance is exactly 6.2 million. Is that a coincidence?
It's a coincidence that it's the exact same.
It's not a typo. We didn't accidentally copy and paste the
No.
one number, one cell into another?
No, it's not a
No.
typo.
Okay, so that is significant to me because that is every dollar of the increase in revenue right now the sheriff is requesting in his increased budget.
That's
Is that correct?
That's correct.
Okay.
Tim, we can't, it's hard to hear you from over there. I don't,
It's also scary to say, yes, that's correct.
can you pull that mic any closer, or is that mic just not a
I'll
good
speak
mic?
right into it.
Oh, there you go.
That, to me, is a huge elephant in this room. It's not sustainable, and I'm saying this to you as if it's your number, right? He's not sitting here. We'll get to talk to him next. But I think that while we didn't get to address his budget today, it is remarkable that that is the situation we're finding ourselves in right now. And with all of the rhetoric and narrative of local governments' wild spending, none of that requested $6.2 million is for the county's general fund services that we are responsible for providing. I don't know how to fix that. I don't know how to address that. I don't know what to do about that. But if we do that, there is no money for anybody or anything else unless we're willing to increase some revenue somewhere to be able to afford that request. And so I'm putting that out there now publicly because we have a lot of work to do between now and then in this community to decide how we address that gap. Are we addressing it by cutting every other service, which I don't think we can cut $16 million, or are we going to swallow the hard pill of talking about increasing revenues? And I think that, I know we are not prepared to have that conversation today, but I'm willing to fall on my sword and say it out loud because I think it's just so gob-stopping to me that is where we are. So
Well, and I
that's
think
my
there's a
comment.
second half to that discussion, and that is, because the question was, are we willing to cut? We can't cut away enough to get to that.
Correct.
It's, are we willing to cut in public safety in order to bring it down? That discussion is
Right.
not for us for here to today.
Right.
But that's where we are. And we've been ramping up to this since I've been here.
The writing is on the wall.
The writing's been on the wall. We've been ramping up to this. I mean, these are just tough discussions every year, and it's not going away. Some are within our control, some are not within our control. But there's no way we can cut out of the county budget enough to sustain this. It's not
No.
going to happen unless we stop picking up trash. I mean, like, those are the discussions.
And that doesn't even go in the, that doesn't even go in the general.
That's not even, it's not even the general fund, but I mean, like,
Yeah.
let's use examples of this reality. We can't get there.
Commissioner Hart, go ahead.
No, I'm done. I mean,
We've
Hey, Commissioner
vomited
Gallardi,
all
do you
of
have
it.
anything to say?
Today's not the day
Nothing
for
else to say?
solutions, but that is the elephant in the room.
We get excited sometimes up here. There is no question, this is basic business. You know, you have a fixed overhead that you have to pay, and you have X amount of income. You have to either generate additional income, or you've got to cut overhead. We've been cutting overhead since we arrived here. When I arrived here, for goodness sakes, we weren't even replacing pickup trucks for, public works to go around and pick up or do any work. I mean, they were like 10, 15, 20 years old with 300-some thousand miles on them. We're paying more to fix them than we would ultimately replace them. But at the end of the day, I mean, I think some of the telling number was 66% of the revenue goes to the constitutionals. We continue to fund everything in this county on the backs of the BCC employees and staff. That's the bottom line. I mean, that's really what continues to happen. We delay projects, we put projects off, we don't fund things. I mean, for goodness sakes, look at the building we're in here. I mean, just take a walk around, look at the carpet, look at some of the paint on the wall. Our employees are working in an environment that arguably is not the best for getting the best product out of our employees and our staff. It's not a beautiful work environment.
And I'll go even further, if you don't mind. It's not just about the beautification, it's about health.
Correct.
If you walk through the building department right now, the air conditioning is not working.
Right.
So this is not a healthy environment for our employees to be working in. It is ugly. It's
Well, I
also
mean,
not healthy. I'm just sorry.
I'd venture to say if you did some air quality tests in this building, you might be surprised. I mean, I could smell it getting off the elevator on our floor, the second floor, different areas around the county services building. But that's ultimately what has happened and continues to happen. And we're going to have some tough conversations. And I think in these briefings, as you give us your recommended budget, you've done what this commission asked you to do at the retreat, was go back, look at all efficiencies, look at all things that you can cut, look at all things that don't impact public safety, cut all things that provide the services that we need to provide to our public, and we still are not going to get there for the ask that we've heard today. And not to mention, every little bit whittles away when there's decisions in Tallahassee that are made. And often they don't even realize the unintended consequences, like the medical examiner situation. And it's every one of those small things that takes $200,000, $1 million, $1.5 million. Every year that continues. You either got to cut services way back, and we went from mowing at one time in this county like every quarter to then mowing once a year, back to citizens' complaints of mowing twice a year to now 3 times a year, just to try to keep up. But that's how deep our staff has looked at making cuts. When you're talking about how many times you mow the right-of-ways in this county, I mean, arguably that's a public safety issue as well, for the roadways and the drainage and, the things that unintended consequences of not maintaining your right-of-ways. There's some tough discussions, and I think those discussions include our constitutionals to be part of that discussion. Law enforcement, public safety. Look, the state of Florida has 100 positions on the state highway patrol they've not been able to fill for now at least 3 years. But they're going to do increases on their law enforcement salaries, and they're doing law enforcement increasements at salaries in this county at some of the city levels and our surrounding sister counties. So what happens is we will end up slowly chipping away and losing our law enforcement officers to others, which then the whole cost of the turnover and training new people and all that, becomes to bear upon that. So it's a tough conversation, but we've got to have it. I mean, we exist for public safety first and foremost, which is our fire and our police and some of the other things we do. So I think we all need to be honest with ourselves that we're going to have some very tough discussions, and some of those discussions are going to include millage increases, as much as I hate to say it. I think, Commissioner Lockhart is basically what you're saying, and I think most of us understand that. We're smart enough to get that. And so, for me, it's about what can be deferred and what can't be deferred. In my briefings, there may be things that we've planned to do or committed to do, and we may have to get down to rating those or determining, because what I'm seeing right now, you're already into reserves and you're going to continue to go into reserves for the next year or two, then there's not going to be any reserves at all. And I'm probably the most vocal on keeping too many reserves, but you got to have some reserves. So, anyone else?
Mr. Chairman, if I may, Tim, can you also list, when you give us the briefings, the unfunded mandates that are coming down from the state over the years?
Absolutely.
And if you could give us a progression of how they've increased over the years? Because I know at one point, a number of years ago, the unfunded mandates, if my memory strikes me correct, it was like a 27, 28 million. I don't know where it is today. I'd just like to know what those are.
Sure, we'll pull that together.
And I bet you, I shouldn't say it that way, but I would imagine that over the years, it's gone a lot higher than what that number used to be. But I'd like for you to verify that.
We will.
Sure.
Because we could talk to our state representatives about that.
Right. Okay. Okay. No other questions or comments for Mr. Jex or the county manager?
No.
Since this is your budget until
Yes.
we
Till I submit it, and then it's ours.
Well, it could be ours for a little bit, but eventually, if we adopt it, then it's ours. All right, next steps.
You already told us, right there.
Yes, so our next meeting will be on June 17th with we'll have a board meeting before that, but June 17th is our next budget work session where we'll hear from the sheriff, as well as we'll do an updated presentation on this, and then the departments as well.
Very good. Make sure there's no one here to speak public comment. If it snuck in. Seeing none. Anything else for the good of the order? If seeing none, we shall be
Was there?
adjourned.
I didn't know if you wanted to mention the medical.
Oh.
Next time.
Yeah.
You gotta be.